Hello, my name is Dr. John Wessling, and I'm a chiropractor, and I've been in practice here in the Wichita area since 1975. And over the next few minutes, I want to talk to you about one of the most common health conditions here in this country, and that is diabetes. Specifically, I'm going to speak to you about type 2 diabetes, which is responsible for nearly 95% of all diabetic cases here in the U.S. Diabetes has become so common that many people don't even bat an eyelash anymore. It's almost as if diabetes has become okay. Just take your meds and you'll be fine. Now, by some estimates, diabetes has increased over 700% in the last 50 years. Now, this reveals two very important facts. Diabetes cannot be just another genetic disease. Now, keep in mind that the prior statistics was taken within the same generation and presumably the same genetics. And then the other is something that we have been doing obviously is wrong and needs to be changed. And that something is our diet. Our diet has changed radically in the last 50 years as well. Now, those of you that fall into the diabetic category have a life expectancy that is shortened by nearly 2 decades. Now, you must understand and know that type 2 diabetes is preventable and reversible while making some fairly simple lifestyle changes. Now, in a healthy person, the pancreas releases a hormone called insulin to help your body store and use the sugar from the foods that you eat, and then turns it into energy. In a type 2 diabetes case, one of two things will occur. Either your body will not produce enough insulin, or your cells ignore the insulin. Now remember, insulin is necessary for your body to be able to use glucose for energy. So when you eat foods, your body breaks down all the sugars and starches into glucose, which is the basic fuel for the cells of your body. Insulin then takes the sugar from the blood into your cells. When glucose builds up in your blood instead of going into your cells, it can cause two problems. The first is your cells may be starved for energy, and then the other is that high glucose levels may cause a multitude of problems, one of which is death from a heart disease, which is 2 to 4 times higher with people with diabetes. Also, 75% of diabetics have high blood pressure, and diabetes is also the leading cause of new cases of blindness. It's also the leading cause of kidney failure. And in about 60 to 70% of people with diabetes have mild to severe forms of nervous system damage, such as impaired sensations or pain in their hands or feet, such as carpal tunnel or peripheral neuropathy. It also can cause poor digestion and erectile dysfunction. Another one is diabetes is one of the leading causes for obesity. Now, symptoms of type 2 diabetes varies from person to person, which may include increased thirst, increased hunger, especially after eating a meal, having dry mouth, nausea and occasional vomiting, frequent urination, feeling tired, weak, and fatigued, having blurred vision, having numbness or tingling of the hands or feet, having frequent infections of the skin or urinary tract. Now, understand that since most treatments for type 2 diabetes utilize drugs, which concentrate on fixing a symptom by raising insulin to lower your blood sugar levels, can actually worsen rather than remedy the actual problems of metabolism and diabetes. Many of these standard recommendations are not based on what's nutritionally healthy, but rather deteriorating it further. Therefore, the instances of diabetes and obesity have skyrocketed. In our office, we offer a nutritional program whereby we use blood, urine, and saliva testing to evaluate what nutritional imbalances, including vitamins and mineral deficiencies, that you may have to help reverse your blood sugar problems naturally without the side effects of drugs. In the majority of cases, people who have type 2 diabetes, not insulin dependent, but type 2, can control and reverse their condition, which usually results from poor lifestyle choices, including choosing the wrong foods and not exercising enough. Now, as a side note, even if you don't have diabetes, it would be important to treat yourself as if you did, because the single most important factor of aging is insulin. If you eat foods that tend to raise your insulin levels, then you will age quicker. Now, interestingly enough, my maternal relatives, my mom, her brothers and sisters, have or have died from diabetes. Now, a few years ago, I had a blood test and I was shocked to see that my blood glucose was 104. Ideally, your blood sugar should be below 100. Now, once I had a better understanding of how insulin works in my body, I changed my diet and exercise nearly 7 or 8 years ago. Now my fasting glucose is around 90 to 95 or lower. Now, with my personal experience with diabetes and having reviewed the medical literature, makes it very clear to me that almost every case of type 2 diabetes is preventable and reversible. Now, if you want more detailed information on type 2 diabetes, you can leave your name and email address below for an online link to a free report. If you have questions, you are welcome to email me at wesslingchiropractic@yahoo.com, or if you're interested in making an appointment, my office phone number is 316-262-3931.